You're watching the Isaiah Factor Uncensored.
All righty, let's start the second half hour with big news on the COVID-19 front when it comes to the vaccine. And thank goodness it's good news. We talk about it tonight.
And joining us tonight on The Factor Uncensored, we have with us Dr. Danish Ali with Arch Point Pain Institute. Dr. Ali, lots going on in the COVID world. First, let's begin with the effectiveness. Well, actually, let's start with mixing and matching booster shots out there, which has always been a concern of mine. If I start with Moderna, I want to finish with Moderna, but they're saying you don't necessarily have to do that.
That's correct, Isaiah. So there's been research being done across the world, and what we're finding out is that with mixing these different vaccines, we're getting a higher immune response. And so currently the Pfizer and Moderna vaccines were 2 single-shot dosages. However, those were the same medications that were being administered, and the idea was to help boost your immune response when you got the second dosage, okay? However, now we're realizing, and what we're seeing is that if you do a different company or a different vaccine, that you may have a more of a response, because the Pfizer, Moderna, and J&J, all of them are treating this virus differently. The way they attach to the DNA and the way that they attach to the virus and the responses that they have. And so now the thought process is that if we were to use one initially and then use a different manufacturer the second time, we're noticing that we're having a very high amount of immune response, which equates to lesser chances of you getting the actual virus itself. Number one. Number two, what we're also realizing is that the effectiveness is longer as well. And so now that the boosters are coming out, I anticipate the FDA will likely come out with a statement that says, listen, if you've had either the J&J or Moderna or Pfizer, now you're eligible or you're able to get a different rendition of the vaccine. That is what.
Got it.
Yes.
And I think this may help people too when they approve the Moderna booster, because right now, if you look around, you search around, and in preparation for the booster for Moderna for me, I was checking around, there's more Pfizer out there in the community than there is Moderna.
That's
so it
correct.
could eventually help people.
That's exactly right. That's exactly the thought process that's currently going, and there's research to support that. And so that's why that's also beneficial. And the other thing is also with the J&J, as you may remember, that was a single shot. And now what we're realizing is that that effectiveness also wears off around 6 to 12 months. And so it's time for that booster. And so what I anticipate on seeing and hearing in the coming days to weeks will be that, hey, if you've got the J&J vaccine, then let's do a different manufacturer's Pfizer or Moderna that will help boost that immune response for you, so you can also help to combat this awful virus.
In the remaining time we have, about 2 minutes, there's some news about Pfizer, the vaccine being 93% effective on young people 12 to 18 years old. Tell us about that.
Yeah, Isaiah. So there was a study that was done looking at multiple different hospitals. They had 180 patients in this study, and all of those had tested positive for COVID, and they were in the hospitals. What we realized, 97% of those folks were unvaccinated, Isaiah, and 29 of those folks or those kids were in life support, and 2 actually died. All of those kids, Isaiah, were unvaccinated. Currently, we have about 46% of the American population in that age group that's currently vaccinated. And so we're encouraging those 12 to 18-year-olds to consider getting the vaccine, because now they're going back to school, there's sports, there's all these activities going on that we can help to reduce this number in this population as well.
Obviously, parents have to get with the program. The best thing to do, once you do the research and get the information that you need, is get your child vaccinated, because we're seeing deaths with young people now. At one point, we thought they weren't impacted so bad or so severely, but now we're seeing different results as a result of COVID-19.
That is correct, Isaiah.
All right, Dr. Danish Ali, always good to see you here on The Factor Uncensored. And of course, we'll likely see you back here again next week with the latest in COVID-19 news, which we absolutely need to keep up with here on The Factor Uncensored and for our viewers out there. Thank you, sir. Always good to see you.
Thank you. Thank you for having me, Isaiah.